in the background that people typically don't think of when they're thinking about provision of health care, prevention of a disease, and those type of things. So things like educational attainment, neighborhood characteristics, employment status, social support networks, those are the type of things that also are important contributors to health that most people typically don't think about. If you look at the research now about the opioid crisis, economists have basically shown us that a lot of that work, a lot of the why we currently are having that is from economic and educational factors that were laid down decades ago, especially for working class whites that increase the likelihood that we would now be dealing with this particular problem. A really nice study that was published in the New England Journal of Medicine a few years back showed that providing sort of housing vouchers into low poverty areas as opposed to high poverty areas or allowing people to maintain subsidized housing actually decades later had an impact on things like obesity and diabetes and those types of things. So things that we don't commonly consider to be health interventions that are really looked at more as social interventions to help people with issues of poverty and education and employment and those types of things also have a very significant health impact as well that we need to consider. Now, with all of that research, my boss, who's a genetics researcher by training, has had to admit that the zip code is actually more influential than your genetic code in whether in the health of your status, your health status. And over half of the contribution of premature death, we know from research, is a result of those social and behavioral factors. Not from healthcare delivery, not from genetic causes, but primarily from social and behavioral factors. So the question I often ask myself is, why is it that so many people, or why is it that people typically underestimate the amount of social and behavioral contributions to health? And I think there are probably a few. I'll just name a couple. One of them is that I think that if you compare it to the biomedical research and biomedical health enterprise, that's very much sort of a market-driven system, and you can't get through a half an hour of television without seeing one or two ads at least about some new drug or new condition that you should be treated for, as well as medical malpractice, injury advertisements as well. So there are good things about being someone who delivers social and behavioral interventions. Not only are things safer, but there's not as much profit motive for someone to go after. So there's not a lot of medical malpractice claims against most of the work that we typically do. But that market-driven system really isn't in place for most social and behavioral work. We still do a lot of work in public health where we're rubbing together dimes and doing sort of the bare minimum of what needs to be done to be able to get the job done in public health. And that's certainly beyond research, just the need for additional funding just in the public health space is an important component of what we need to do. The other thing is that I think, at least for me, I feel like most of these social factors that contribute to health kind of run in the background. They're things that just sort of happen and most people don't pay attention to them, but they're important in the contribution to health. So things like choice architectures and some of the behavioral economics work that's been done, we call them nudges for a reason, right? We call them nudges because most people don't even notice that they're being nudged in this direction or that direction, or to make this choice versus that choice. It just sort of happens. Tobacco taxes, as much as people rail against the fact that they are as high as they are, and in reality they should be substantially higher in a number of states in order to be able to have an impact on cessation initiation, or on smoking initiation, or on cessation. Even though they need to be higher, they're rolled into what you get for a pack of cigarettes, right? They're rolled into the cost, so you don't typically see that. A smoker doesn't go to the counter at the 7-Eleven and the person say, okay, well, your cigarettes are 30 cents and your taxes on that are $3.40. But they don't see that discrepancy or that difference because it's just rolled into the process. It sits in the background and it runs on a regular basis to adjust and change how our social environment influences the health of the country. And I think that's one of the things that we have to think about is that a lot of this isn't the things that you see all the time. Our public health colleagues at the CDC who regularly are doing work in infection control and infection disease, the Zika virus didn't go away. They just did a really good job of getting on top of it and managing it and controlling it. And they do that now and they do it in the background. And you only notice it when it only pops up when they don't do that very well. Most of the time it just happens in the background. I will also say that this is from the NIH perspective. You could also be sort of misled about the importance of social and behavioral factors, because of all the grants that we fund at the NIH, about 10% of them have a social and behavioral aspect, so 90% do not. So my job, and you could look at me and go, well, you should be doing your job better. Right? My job is to make sure that more of the research that we fund at the NIH has some of those social and behavioral components. It doesn't mean that we have to fund only social and behavioral research that has relevance to health. It means that we have to make sure that the research that we do has those social and behavioral influences part of it, right? That it's just included in some of the things that we do and some of the things that we think about as far as these issues. There's a lot of things that I think the NIH funds and funds well, and some really nice research. I'll just give you a few examples of some of the things that I think are out there. And I give these to you in contrast to what you sometimes hear when people decide, here's a wasteful expenditure. I look at that among the 2,600 grants we funded last year. I hardly ever find any of these wasteful expenditures. That doesn't mean that we couldn't do our job more efficiently and there's not better research and less better research. But there are things that we funded like adolescent binge drinking and its effect on brain development and adult behavior, on modeling complex social dynamics of influenza and vaccination processes, abandoned house remediation. You wouldn't think this is something that the NIH would fund, but abandoned house remediation and how it impacts things like substance abuse and violence. Strategies to promote social smoking cessation among people who don't have the interest in quitting or don't want to quit, because that's a whole different group of people than the folks who do. And then opioid prescribing patterns among Medicaid providers. It's just a few examples of the sort of things that we fund on a regular basis. That's just, what, 5 or 6 of the 2,600 grants in FY16 that the NIH funds that have a social behavioral component to them. So I think it's important, as I look at this space, to think about how broadly social and behavioral sciences influence health in all various ways, that the research that the NIH funds can help support and advance that research moving forward. Thank you.
Those are all really excellent, and I think it probably got us all thinking about some questions and some follow-up. And we really want this panel to serve as a sort of Ask the Experts opportunity for you all. So we'll open it up to questions, but I want to start with just one that I think might be relevant to many in the audience here, which is from each of your disciplines or areas of study or your unique perspectives, what would be one piece of research-related advice for policymakers that you think would have an immediate impact?
No one's going to jump in. I'll start. I won't give advice to policymakers given my position, but I will say that I was happy to see the evidence-based policymaking report come out. Nice to see a greater focus just on, as we think about policies, thinking about the evidence base for them. What's the research that helps us decide whether this is an appropriate policy or not? Having solid administrative databases that would allow us to be able to track the impact of that policy over time. You know, we often talk about states as being sort of experimental places where we can test policies across the states, but it doesn't matter if you don't have good data to determine whether that policy had an impact and what that impact was. So having really good data sets to help with that is really important as well.
I'm not sure how immediate an impact this would be, but I just want to underscore a point I made earlier, which is that it's all well and good to have research that says something works or something doesn't, but far too often that research is, one, lacking in rigor, so not just good enough to follow as a recommendation, but two, far too often we'll look at evaluations and take them as truth, absent any kind of attention to what's going on the ground. So what I mean by that is, so you have an evaluation of something like work release. So people who are incarcerated get to be released and go out and work in the community and come back at the end of the day. And you have a very rigorous study that finds that it doesn't work. And so does that tell you should just not invest in that in the future? And I would say no, not if you haven't also attended to how well that work release program went. And far too often we hear about how people should do these rigorous randomized controlled trial evaluations to be able to deliver the truth about what works, when those evaluations aren't accompanied by what we would call implementation or process evaluations to find out whether that was actually implemented as intended. So you might find that if you have an implementation evaluation, well, you know what? The people enrolled in the work release program really felt like sleeping in, and they had the opportunity to do so because it was really all voluntary. And so only about 20% of the people in the program actually routinely left on their work release jobs every day. So that doesn't mean that work release doesn't work. That means that the way it was implemented doesn't work. And that's more than a nuance. It's a very important part of evaluation that's often overlooked. And I think it needs to be attended to if we're going to actually take research findings and use them for policy and practice.
And I guess I'll be the one to speak up for giving research priority generally across federal policy making. Staffing the offices that are responsible for overseeing the research organizations within the federal government, putting priority on research funding through the budget process. There is an astonishing amount of competition for research grants, which is a good thing, but there's also an astonishing amount of time spent on writing good ideas up that never get funded because our programs are way oversubscribed and the success rates are so low. So to unleash some of that torrent of good ideas and innovation by increasing priority for research funding within the budgeting process would have a fairly immediate impact, at least in terms of getting those ideas out there. And I say this in the context of a global system where our economic competitors are increasing their investments in ways that are really significant compared to the flat funding we've sort of enjoyed for the last few years here. And so it makes me concerned both from a national security and economic competitiveness perspective, but also I can see the community struggling to get funding for good ideas when some, high-profile programs in the National Science Foundation have success rates of 9%. 91% of the grants that are put in there, many of which are rated very highly, are never funded. So I'll make the crass call out for them.
All right, let's open it up, and if you would introduce yourself and your affiliation. What's on your minds?
I'll go. Hi, Neil Canfield. I'm actually from the National Science Foundation, and I think Nancy, it may have been you who hit on this point. Oftentimes, what I hear when people talk about social science is, my parents even say it, it's not common sense. How do we get across the scientific rigor that goes into the studies that help you understand how humans are affected or affect things like cybersecurity and computing and health and crime, and the statistics that go into that? How, from your field, what is your recommendation about how to highlight the actual science that is a part of social sciences?
I'm not sure highlighting the science would be particularly persuasive to people who think that we already know the answer to everything. I think a better answer would be, yeah, you're right, it is common sense that substance abuse treatment would help people refrain from the use of illicit substances. That's not the question as much as why, for whom, where, how, all of those things that go into effective delivery. And those are the questions that I think we answer, and that's the value that we add.
If I can, I would add that this comes up a lot of times. I mean, when I was in graduate school, I had this panic of feeling like I was in the science of the intuitively obvious for a period of time. And it's a common phenomenon for people to go, well, that's common sense. But it's only common sense after you explain to them what the phenomenon is. So I'll just give you one of many. There are tons of them, right? Bystander apathy. The prevailing thought was that the more people there are around, the more likely you are to get help if you're in trouble. Turns out that's not necessarily the case because of the diffusion of responsibility. People go, well, there's 12 people here to help this person, so I don't need to be the one that does it. And as soon as you explain that, people go, oh, again, that's common sense. Well, it wasn't common sense 5 minutes ago before we changed to then show you that it's just the way people do the thing. But we're all, our brains evolved to be amateur behavioral theorists, right? We all do this. We do it because our whole purpose, the whole reason your brain functions is so that you can regulate your behavior and your body and the behavior of the environment and the behavior of other people and all of those things. And so you, of course, try to apply this stuff as quickly as you can as soon as you hear it. And that's part of our problem, is that everybody's, you know, there aren't a lot of amateur genetic theorists out there.
Right.
There are a few, but there aren't a lot. But everybody's an amateur behavioral theorist.
I'll just add from the computing research community that I think one of the approaches that we take into the organization is to try and seek out opportunities to bring the disciplines together into the same room. We have an activity that Ann Robbins here, who's sitting in the audience, runs at Sierra called the Computing Community Consortium, CCC, which seeks problems that require the input from across the disciplines. And we find the serendipity that results when you bring all these people from disparate disciplines into the same room is incredibly productive. You get all sorts of interesting collaborations that happen, and you get a greater respect for each other's discipline and work as well, because you see the rigor that goes into it. And so I think building this sort of infrastructure, I mean, we're doing it at the organizational level, but ways in which policy can encourage it, doing it at a larger scale, that brings the disciplines in closer contact with each other, I think can go a long way towards increasing the respect the disciplines have for each other.
Other questions?
I have two questions actually, but I'll just leave my second one. My question is, you know, all of you spoke about ways in which social science research could be incorporated into policy making more effectively. And I'd like to know whether there's a social scientific nudge, if you will, a systemic change that might be implemented to ensure that social science research is consulted before policy change is effective. For example, there could be a law that says any new policy must be accompanied by a research gathering exercise that ensures that whatever change is made is then documented, and then that those documented changes are then consulted again. That's just an example. Can you think of something else that might be useful?
I can think of the criminal justice correlate to that, which is in some states, the federal system to some degree, there's something called sentencing impact statement. So whenever there's a new law on the table, typically, enhancing penalties for a certain type of crime, whatever the new crime du jour is, we need to have folks analyze the impact of that policy on prison population and on cost. And then we've seen more recently examples of some states that have gone further to require racial impact statements. So to what degree will new sentencing policies result in a disparate impact on people of color? So these are, again, legislative examples.
I just added, as you were describing that, and they now have a different name, which is a shame because it's not called the Social and Behavioral Sciences Team anymore. They're called something else now. That doesn't specify, what is it? Evidence team, yeah. Which doesn't imply that it's social and behavioral research that they're doing. But their purpose, and I wish they could be used more, is to essentially go out when people have new policies they're thinking about implementing or new procedures they're thinking about implementing, and evaluating them, determining what the prior research would tell us about how best to do that, evaluating them ongoing to make sure they determine what kind of nudges and changes and modifications need to be made over time. Having more capabilities like that within each of the systems that needs to put out these procedures and policies, I think.
Yes.
So my question is a bit more specific. How do you see social and behavioral research intervention reducing racial and ethnic disparities in health?
I think it's pretty crucial. If you look at most of the determinants of the health disparities, those are social and behavioral in nature, right? It doesn't mean they're entirely that, but the vast majority of them come from neighborhood influences, educational and economic influences, the types of things like that that sort of drive those health outcomes. Surprisingly, even though people focus on access to healthcare a lot, it's not the primary driver of those health inequities. It's a component of it, but it's where we've tended to focus for some reason, but not on the more substrate levels of social determinants that are actually influencing that on a regular basis. So, neighborhood characteristics being a pretty significant.
So I have a question. One of the challenges we face, COSSA as an organization and our community face, sometimes with policymakers, is the argument that this work can be done by the private sector instead of the federal government. And so I'm curious, because you all sit in very different places and positions from within the government and outside, if you could speak to the unique role that the government plays versus what can or cannot be done from an industry perspective.
My mind's racing in a certain direction that might not be where you were thinking, but so let's just take the example of private prisons. We leave it to the private sector. What, how biased do you think that those evaluations would be? Or we let the company that is the predominant purveyor of body-worn cameras do that evaluation. Are they going to look under the hood and talk about how it only works in certain circumstances, or there might be some biased implications for different types of officers? Probably not.
I mean, I can say from the computing research community, we get the same question about basic research all the time. If the Googles and the Microsofts of the world are so successful in basic research, why don't they just pay for it all as well? And to a degree they do. They're in an interesting position just by virtue of their size to fund a degree of basic research, but it's really not in their mission. It doesn't make as much sense. It certainly doesn't make sense to their shareholders to be working on work that is 5, 10, 15 years out into the future. So we like to talk about this incredibly robust and productive interplay between the federally funded sort of university research ecosystem, the industrial researchers who tend to be a little bit more applied in their work, and the flow of people and ideas back and forth between these systems. And this ends up, we usually at this point in the talk would show you a great chart that we have of the development of the IT economy, which is a timeline basically that shows this great flow of ideas and people back and forth between these two sectors. And what makes essentially a $4 billion investment every year by the federal government in IT research and development across the entire federal government pay off in terms of these companies that have market share on the order of $1 trillion. So it's an incredibly productive thing. We don't like to muck it up a little too much by tweaking the knobs too much, but there's a definite role and a different character of work that goes on in the universities, that goes on in the industry research labs, and that flow between them is vitally important to our competitiveness.
I'll just add, before the NIH, I dabbled in Peter's area, was in a private R&D company trying to commercialize and automate some of the public health interventions that we do. It's hard to produce a business model for that. Not that it's impossible, but no one's making money hand over fist selling public health interventions. And it's just difficult to produce that way. And so whether it's in the delivery of it on the public health side or in, I think what Nancy and Peter both have made a good point about, which is on the fundamental research aspects of this, which need to be funded by the government because no one else will fund those, right? The basic research that lays the groundwork for the applications that come out of it.
Any other questions? Yes?
Yeah, well, following on Wendy's question, kind of like devil's advocate, another argument that I hear sometimes is, well, social science is really predominantly valuable in the context of other fields, computer science, criminology, health. So why do we need to have a whole directorate focused around, basic research in social science? Why not just sort of tack it on as a supplement to other studies? So I'm wondering what he thinks of that.
So from because we hear that sometimes from the computer science side, and our response is always, we know nothing about how to train social scientists. We don't know how to fund fellows in sociology. We can't deal with postdocs or grad students and so on. So there's just a practical matter of, it would be just the startup cost for us to get up that curve to understand even how to do it is imponderable. And it doesn't make sense. It completely also devalues the role of the social sciences in general as a legitimate system.
Other questions, comments, thoughts? Well, if not, thank you all for coming, and thank our panel, who I think will stick around for a few minutes if you wanted to have offline questions or conversations. But thank you all, and thank you